Assessing the musculoskeletal system.
Assessing the musculoskeletal system. Assessing the musculoskeletal system includes inspecting and palpating the joints, muscles, and bones, testing ROM or range of motion, and assessing muscles strength. The purpose of this procedure is to provide data regarding for client's posture, gait, bone structure, muscle strength, and joint mobility. The equipment to be used are tape measure and reflex hammer. Considerations before, during, and after the procedure. Identify client and explain procedures. Perform hand hygiene. Make sure client is comfortable throughout the process. Document all findings. Things to document after the procedure. Observation. Findings are either normal or abnormal. First is introduce and verify the client's identity. Explain procedure to the client. Provide privacy. Good day, ma'am. Are you Miss Ma'am? Okay, I am Nurse Rahma Naim, your nurse for today. I am going to assess your musculoskeletal system. Is it okay to go, ma'am? This is to gain cooperation and lessen the anxiety of the client. Perform hand hygiene and observe appropriate infection control. This is to minimize contamination. Next, compare bilaterally during assessment. This is for baseline assessment. Okay, so, and for symmetry, contraction, and strength. Okay, for the muscle, inspect the muscle for size. Compare the muscles on one side of the body, such as the arm, thigh, and calf, to the same muscle on the other side. For any discrepancies, measure the muscles with a tape. I am going to measure your arm. Normal findings, equal size on both sides of body. For the abnormal findings, atrophy, which is a decrease in size, or hypertrophy, which is an increase in size, asymmetry. Okay, next, inspect the muscles and tendons for contractures, which is shortening. For the normal findings, no contractures. Abnormal findings, malposition of body part, such as foot drop, which is the foot flex downward. Inspect the muscles for tremors, for example, by having the client hold the arms out in front of the body. Normal findings, no tremors. Abnormal findings, presence of tremor. Test muscle strength, compare the right side with the left side. Please, mom, please sit down. For the sternocleidomastoid, client turns the head to the side against the resistance of your hand. Repeat with the other side. And for the trapezius, client shrugs the shoulders against the resistance of your hands. Mom, shrug your shoulders. And for the deltoid, client holds arms up and while you try to push it down. And for the triceps, client flexes each arm and then tries to extend it against your attempt to keep arms in flexion. For the biceps, client fully extends each arm and tries to flex it while you attempt to hold arm in extension. For the triceps, client flexes each arm and then tries to extend it against her attempt to keep arm in flexion. And for the wrist and finger muscles, client spreads the fingers and resists as you attempt to push the fingers together. For the grip strength, client grasp your finger and middle fingers while you try to pull the fingers out. One can hold my fingers. And for the hip muscles, client is in supine position, both legs extended. Client raises one leg at a time while you attempt to hold it down. Ma'am, i-raise mo yung feet mo when I am going to push it up. Hip abduction, client is supine position, both legs extended. Place your hands on the lateral surface of each knee. Chest spreads the legs apart against your resistance. And for the hip adduction, client is in same position as for hip abduction. Place your hands between the knees. Client brings the legs together against your resistance. Hamstrings, client is in supine position, both knees bent. Client resists while you attempt to straighten the legs. Ma'am, please. Quadriceps, client is in supine position, knee partially extended. Client resists while you attempt to flex the knees. Muscles of the ankles and feet. Client resists while you attempt to dorsiflex the foot and again resist while you attempt to flex the foot. Okay, for the normal findings, equal strength on each body side. Grading muscle strength, rating, and indication. And for the zero rate, 0% of normal strength, complete paralysis. And 1 rate, 10% of normal strength, no movement. Contraction of muscles is palpate or visible. 2, 25% of normal strength, full muscle movement against gravity with support. 3 rate, 50% of normal strength, normal movement against gravity. 4, 75% of normal strength, normal full movement against gravity and against minimal resistance. 5, 100% of normal strength, normal full movement against gravity and against full resistance.